Turf toe, in its simplest form, is a sprain of the ligaments and/or the joint capsule on the plantar surface or bottom side of the big toe joint. However, some severe cases may also include an injury to the tendons, sesamoid bones, or even result in a fracture or dislocation. Turf toe most commonly occurs when an external force is applied to the back of a foot fixed on the ground, driving the big toe into hyperextension. For example, in football, this usually occurs when a player falls onto the back of another player's foot. It can also occur during cutting and push-off maneuvers, a similar mechanism which happened to Patrick Mahomes in 2020, but this is less common. In 2002, Anderson classified turf toe into 3 grades based on clinical signs and symptoms and imaging findings. Grade 1 injuries often present with mild swelling and joint tenderness and show no signs of structural damage on imaging. As severity increases, additional findings include bruising, a decrease in big toe range of motion, and an antalgic gait, or more specifically, a hesitancy to push off during walking secondary to pain. Grades 2 and 3 will also show signs of tissue damage on an MRI scan. Due to the small size of this joint, an injury to this area is often brushed aside as being insignificant. However, the big toe plays a pivotal role in your ability to run, jump, cut, and change directions, so proper management and treatment is key. In general, rehab for turf toe will follow a loading continuum. It often begins with a period of unloading, and over time, progresses by gradually increasing the load placed through the big toe joint. This continuum will likely be dictated by severity of injury and symptoms. For example, with more severe cases or when pain is high, your tolerance to load will likely be low. But then, as symptoms calm down, your tolerance to exercise and activities which place higher loads on the big toe joint will improve. Because treatment options vary widely based off of the individual, severity of injury, sport position, etc., I'm going to provide guidelines which follow this loading continuum. That will allow you to self-guide your rehab based off of your tolerance and individual needs. Options will include strategies for joint protection, exercises for improving range of motion, strength, and balance, and a progression for safely returning to sport. Joint protection. The goal is to restrict big toe extension during walking and other activities in order to manage pain and let sensitive tissues calm down. In the initial days or weeks following a more severe injury, a walking boot or splint, with or without crutches, is used to immobilize and offload the joint. In less severe cases, or as symptoms subside, orthotics, shoe inserts, taping, or stiffer shoes can be used to limit big toe extension. And finally, as pain decreases and tolerance to activity improves, you can gradually transition back to a more flexible shoe. However, as you return to your sport, you may continue using shoe modifications, an insert, or taping if desired. Big toe extension range of motion. Big toe extension can range anywhere from 55 to 80 degrees. At minimum, you should aim to restore range of motion that is equal to your uninjured side. This will help reduce risk of re-injury and prepare you for the demands of your sport. Here are 3 levels based on the load placed through the big toe. Find an appropriate level which you can perform without pain and progress over time. Level 1, self-joint mobilization. Start by stabilizing the base of your big toe with one hand, while you use the other hand to pull the big toe into an extended position as far as comfortable. Repeat this motion for 2 to 3 sets of 15 to 20 repetitions, 2 to 3 times a day, or as tolerated. Level 2, terminal stance. Stand in a split stance with both feet pointing straight ahead and shift your weight onto the lead leg. While keeping the big toe joint on the ground, lift your back heel as far off the ground as you can without pain, moving the big toe into extension. Repeat moving in and out of this position for 2 to 3 sets of 15 to 20 repetitions 1 to 2 times a day or as tolerated. And level 3, split squat. Stand in a split stance and slowly lower your back knee towards the ground, moving the rear toe into extension. Unlike a standard split squat, the goal here is to eventually shift a majority of your weight onto the back leg in order to increase load through the big toe. Try and keep the big toe joint on the ground throughout the full movement. Perform for 2 to 3 sets of 10 to 15 repetitions every other day or as tolerated. In addition to these, you should also perform active big toe extension as soon as possible following injury. With your foot flat on the ground, actively lift your big toe up as far as you can without pain, while keeping your other 4 toes on the ground. Early on, this might not be very high, but eventually you want to be able to move into as much active extension as your uninjured side. Do this for 2 to 3 sets of 15 to 20 repetitions every day. Calf strength. Heel raises will help maintain or improve the strength and capacity of your calf complex, while also increasing your tolerance to loaded toe extension. Here are 3 levels based on the load placed through the big toe. Level 1, seated double leg heel raise. Level 2, standing double leg heel raise. And level 3, standing single leg heel raise. Find an appropriate level which you can perform without pain and progress over time. For either of these levels, if the movement is too painful, you can try to shorten the range of motion you move through. However, the goal is to move through full toe extension without pain before progressing to the next level. Optional exercises. In more severe cases when there is prolonged immobilization, balance and toe flexion exercises can be an additional consideration. These should be performed without pain and can be implemented as soon as tolerated following an injury. Single leg balance progression. Level 1, single leg RDL. Level 2, single leg RDL with knee drive. And level 3, three-way RDL with knee drive. This is the same as the previous exercises, but now you will alternate reaching hands towards the left, middle, and to the right. Find an appropriate starting level and perform these barefoot for 2 to 3 sets of 60 seconds on each leg every other day. Toe flexion progression. Level 1, passive toe flexion. Stabilize the base of your big toe with one hand while you use the other hand to move your toe in and out of a flexed position. Level 2, active toe flexion. Actively curl your big toe as far as you can without pain. And level 3, towel curls. Sit with your feet on the ground and a towel underneath your toes. Curl your toes, pulling the towel towards you. Find an appropriate starting level and perform for 2 to 3 sets of 15 to 20 repetitions every day or as tolerated. Return to sport. Exercises and drills in this category will vary widely depending on your sport and position, but you can use the same loading principles just mentioned in order to help guide activity. Early on, when loading is more painful, activities such as biking or swimming should be implemented to help maintain fitness levels. These should be performed pain-free. Once tolerated, begin walking and then progress to jogging in a straight line. When you're able to jog pain-free without a limp and demonstrate at least 50 to 60 degrees of painless passive big toe extension, you can progress to running and jumping exercises. And finally, it is recommended you are able to perform linear running at full speeds before beginning cutting and change of direction drills. These should be completed without residual pain before gradually returning to your preferred sport or activity. In most cases, turf toe can be treated conservatively, but there are several indications which may lead to surgical consideration. These are listed here on the screen, and you can pause the video if you'd like to read through them. But regardless if you do conservative management or choose surgery, you can follow the same principles of the loading continuum just outlined. Overall, rehab for turf toe should place an emphasis on reducing symptoms and restoring function rather than following a set timeline, since recovery is widely variable person to person. For example, in less severe cases, such as with a grade 1 injury, return to sport may only take a few days, while in more severe cases that require surgery, full recovery may take up to 12 months. In summary, turf toe occurs when the big toe is forced into hyperextension, resulting in a sprain of the ligaments and/or the joint capsule on the bottom side of the joint. Injuries are often classified into 3 grades of severity based on clinical signs and symptoms and imaging findings. The strategies, exercises, and return to sport guidelines outlined previously follow a loading continuum, which gradually places more stress and load through the big toe joint. Find an appropriate starting point for you. Over time, as symptoms reduce and tolerance improves, slowly move toward the right side of the continuum, going as far as you need for your goals. Thanks for watching. If you enjoyed the video, do us a favor, tap that like button, subscribe, and if you have any questions, comments, or suggestions on future videos, you can drop those in the comment section below. Until next time.